So I'm here to look at global health. And when I checked out Dr. Sri and everything he's done, I thought, you know, I'm going to present another kind of vision of global health and what you can do in terms of service in the world as well. So I'm going to share my experiences as a medical anthropologist through 3 different approaches. One is an educator in health and wellness and something I've been learning about in the medical tourism industry. And as a university professor who helps graduate students adopt NGOs, international NGOs, and how to investigate how you can actually do service in the world through non-governmental organizations. And then finally, I'm going to do a little bit of travel with you. And we're going to look at a phenomenon in the world right now of spiritual health pilgrimages. So it's another aspect of global health as well. First of all, let's look at these 3, and also some safeguarding of indigenous healing practices, which has been a lot of my work as well in medical anthropology. So let's start with medical tourism. How many are familiar with that word right now? You've heard about it, you've seen it. I was pretty shocked about this. I think the why behind medical tourism is because, you know, we've taken some hits here in the US. We're often cited as our healthcare spending is 1/6 of our gross domestic product, and we're still ranked 37th in the world overall, 41st in some aspects of maternal child health. And these statistics, of course, are looked over in a broader spectrum. I have not enough time to go into how they're. Do you know what we are #1 in? Prison populations through the world. So in some of the ways that we look at this highest incarceration rate we have, and we're also highest in payments out of pocket for complementary medicine. And we're climbing right now with charitable contributions to global health initiatives through major philanthropic organizations. We aren't the biggest, though. It's pretty amazing. There's a lot of countries that put us to shame in terms of a per capita global health expenditures. But I went to the Medical Tourism Convention in November. It was in Chicago. I was blown away by this. There's a PR firm for every nation right now trying to get you to come there to get your medical services. Singapore, India, Brazil, Ecuador, Turkey, Taiwan, I visited all of their booths. And each one of them said, we will save you $10,000 to $40,000. We'll do all your cosmetic surgery and we'll do your dental work as well. And we'll even throw in a facelift with your hip replacement. Pretty amazing. In Chennai, India, when I've been doing a lot of work in Chennai over the years, you can get a month-long stay at a spa in Bangalore right now. And I just interviewed somebody who came back from their $5,000 hip replacement at Apollo Hospitals in Chennai. It's a big chain of hospitals. And then went immediately to, had the facelift, and then immediately went to a 30-day stay at a Bangalore spa. And I said, what was the total bill? And she says, well, that added another $2,000 to it. So this is some of the reason why medical tourism is taking off. People combine their vacations with it as well. Turkey has positioned itself as the bone marrow transplant kind of center of the universe right now, offering $30 bone marrow transplants, cataract surgery for only $230, a liver transplant for $61,000. And believe me, there are a lot of people on lists for livers that do go overseas now. This one center in Antalya, Turkey, is thriving in terms of all of the people, even through the EU. #1 in Brazil, exactly. Do you know what the surgery is? The gluteal implant. I just came back from Brazil in January, where this was the #1 surgery down there. Something about the southern hemisphere. The north wants breast implants, but as soon as you go south of the equator, they want to expand the other half of the body. So this surgery is so popular right now that they have special seating in restaurants in Brazil for people who can't sit on their bum for a good 6 months. This service right now in Taipei kind of blew me away. The CyberKnife. Some of you have heard that, right? Right now, this Wanfang Medical Center in Taipei promotes its center as the only CyberKnife clinical practice training center in Asia. CyberKnife is a sort of non-invasive alternative to surgeries. It's for treatment of both cancerous and non-cancerous tumors. You can, of course, get it right here in the Bay Area as well. Most of the CyberKnife doctors in Asia were trained here in the US, and they learned to operate these very high-energy beams of radiation. There's some robotics to it, too, to align the linear accelerator from a wide variety of angles. It's very high-tech. Can you get CyberKnife surgery here as well? It depends on your insurance. So this is why some people read about it, discover it, and maybe get on a plane to Asia for it. Very interesting. Ecuador. Who would think of going to Ecuador for medical tourism? You are met and greeted at the airport. You get lodging and meals in an Amazon Eco Lodge before and after your surgery. And you get hotel and transportation anywhere in the country afterwards. You get concierge service and tourism package. So all of this is now included. This is why medical tourism has taken off globally. It's very interesting. We've looked at the effects of globalization from NAFTA and everything else on the exportation of job markets. We looked at the decreasing middle management jobs in the US and bemoaned what's happened to our jobs. How do we retrain in an information age? We do have to seriously look at medical tourism and what it's doing too. I think the big questions we need to ask is where you would go for what, what's safe, what's not. You would almost need a global health consultant to figure this all out. And wouldn't you know, they are a new profession. Believe me, people are lined up to offer that service. Pam Bramerton, she's an RN. She's president and managing director of this IHT World. I called her up, interviewed her. She said, well, as a nurse, I became very frustrated with what's going on in our healthcare system. And I discovered that I can offer a service to people and explain to them who actually has decent service out there. So she started this IHT. It's customized medical tourism service. It helps people reduce their overall health care costs. And she says she mostly works with people who are underinsured. And the underinsured is a large number. We often talk about the uninsured America. Before the Affordable Care Act was starting to chip down that number, it was anywhere from 45 million to 60 million. But when we talk about people who are underinsured in the US, the estimates are everywhere from 90 million to 120 million. And this is her market, this smart nurse. She goes after them. I said to her, what guarantees of safety do you actually give people? And she said, not many. But there is a brand new medical tourism association that's starting to look at accreditation of various hospitals. I said, there's some real major concerns I have about this. For one, in Asia, liver transplantation has become really big business. With an ongoing and an increasing shortage right now of cadaver livers, transplant centers in Asia have adopted living donation as a partial solution to this shortage. We have different state laws about that here in the US. But individuals now recognize that by donating a portion of their liver to a relative or a friend or a co-worker, or in Asia, a total stranger, they can make this gift of life and they can receive quite a bit of money for it too. So are these people really making a gift? In the US, it has to be a gift. What we're finding is there is a black market sale, in organs by desperate people needing money. And it's creating a real nightmare in medical ethics right now, in human suffering and exploitation. We've all read enough about sexual trafficking, but did you know that there is quite a market growing in organ trafficking as well? So that's probably, aside from that, I know that any surgeon in the room might be thinking, well, what do you do if you've gone abroad and you've gotten your liver and you're on autoimmune therapy after that? How do you follow up with that? What is the follow-up care exactly? How many times do you have to get on a plane to go back to the country of origin where you got your liver? So these are some of the things that I brought up with this nurse consultant in medical tourism, and she said, we're still working that out. We're working that out with some accreditation ideas. JCI, of course, is the Joint Commission International. It's an international subsidiary of JACO, J-A-C-H-O. It's the US-focused Joint Accreditation Commission for Healthcare Organizations. We've all been through that process if you've worked in a hospital. But this JCI is currently the global accrediting body, trying to track what's happening in medical tourism. There's also another organization, this one down here, International Society of Quality Healthcare. trying to be another umbrella organization that accredits each individual hospital. There's two leading ones right here, one in New Zealand and one in Singapore, I think were the best that I investigated as well, that are actually a large network of private hospitals that probably are equivalent to what we go through with our own JCAHO accreditation. So ask yourself this question, though. Does lower cost always mean lower quality care? Does higher cost mean higher quality care? What have we found, even in its own country, looking at that? The Dartmouth Health Atlas discovered that when there are vast differences in Medicare payouts across the U.S., that the amounts of these payouts don't necessarily equate with improvements in health outcomes. So in many times, the less money that's spent often has a better health outcome. Gilbert Welch, did anybody get the New York Times? A brilliant editorial in there a couple weeks ago. He's a professor of medicine at Dartmouth at their Institute for Health Policy, Clinical Practice. I get a lot of information from Dartmouth. He's author of a new book, Overdiagnosed, Making People Sick in the Pursuit of Health. And he wrote in this New York Times op-ed just last week that we might all be better off if the medical system got a little closer to its original mission of helping sick patients and let the healthy just be. He's probably looking at the fact that sometimes our over-screening or overzealous ideas about screening, diseases like heart disease, autism, glaucoma, diabetes, vascular problems, osteoporosis, and cancer, do all the screenings really result in lower death rates? Actually, one of them does, and it just had some good research on it. You know which screening does result in lower death rates? You know, shout it out. Colonoscopies. It just had some really nice data on colonoscopies. So that one, still get your colonoscopy for sure. But we're starting to look at the fact that your preventive health really is not just a matter of screening. It's a matter of doing everything Bill Stewart was talking about with you, Dr. Stewart was talking about with you, eating broccoli and going for your walk and meditating and taking in that personal example of how am I living in my own holistic lifestyle here. I think there's also a wonderful book out right now if you want to know more about comparisons of healthcare throughout the world, and it's written by T.H. Reid. It's called The Healing of America, A Global Quest for Better, Cheaper, and Fairer Healthcare. And what Reid did was take a look at every country and say, where is socialized medicine really? And he didn't find it anywhere. He said the greatest example of socialized medicine is right here in the U.S. with Medicare. It is a single-payer system of universal coverage over a certain age. He said the rest of the countries, like Japan and Sweden, all have this sort of patchwork of a little bit of private, a lot of government regulated, and some other kind of government exchanges, but definitely patchworks in which there was supposedly a safety net where a lot of people didn't fall through. So I think that what we do have in America is remarkably resilient. Even though our economy is still sluggish, our political system is in a stalemate, we have a great capacity for self-renewal, and that still is the envy of the world. I think we also have big hearts, and we open our wallets with generous giving, which leads me to my second area of focus, global health service with support and volunteerism. So, this is the UN Declaration of Human Rights, that everybody has a right to a standard of living, adequate for the health and being of oneself, and that is with one's family, food, clothing, housing, medical care. And if you really believe that, you'd love to know that that's the case for people around the world. But just as we saw in Dr. Shree's presentation, there are some vast differences going on. Why care about global health? Good question. You know, I attended a conference, Time Global Health Summit. It was an invitation-only conference. 50 journalists got to go, and I snuck in as a medical anthropologist, and I actually got to interview Clinton and Gates and ask them, you know, why care about global health? And they said, well, it's an interesting effect that we should care about it, because in some ways we can have somebody dealing in sort of a filthy animal trade in a rural province in China, who leaves that rural province and enters an elevator in Hong Kong and sneezes like crazy, and then somebody gets on a plane and goes to Toronto, Canada, within 5 days, and 2 weeks later, we're starting to see 23 people dead of SARS. That's how fast we have to care about global health. When that happened, it sent chills through the entire global health community, and we realized our surveillance systems were inadequate. Our reporting was inadequate, and we were looking at some of the basis of shame and not wanting to report certain things in certain countries, and how can we actually open this up with an honest dialogue. I think that global health means such different things to so many people that in one part of the world, doctors are treating dysmorphic body dysmorphia, a diagnosis that's unheard of in other places, and they're treating sexual arousal disorders, complaints that must seem so insignificant to villagers in sub-Saharan Africa, where 3 out of 4 children under 5 die from causes that are rare in the developed world: pneumonia, infectious diarrhea, malaria. So when we look at the headlines with this kind of increased awareness, there's a growing sense from all global health experts right now that sometimes it seems like in parts of the world things are worse than ever. And why is that? I think just a cursory review of some health indicators revealed that Africa is sicker today than it was 40 years ago. So social scientists, as myself, start to look at post-colonial legacies and resource exploitation and inefficient governments and corruption and warlord-dominated factions and all sorts of trapdoors out there on why your dollars don't always get to the people who need them most. There's a maxim as well in global health that if you help the women, you help the world. So I've been really moving from the sidelines into more women's health-oriented kinds of networks too. So, from the multinationals, some NGOs that you might be interested in, large ones like USAID, Carter Center, Partners in Health that we heard about, to more local ones as well. I put Partners in Health in both. It's a multi, but it has a very local capacity building focus, and so does Carter Center as well. This is actually the more multinational ones, Rotary and Project Hope and Red Cross and Oxfam. Perhaps you've donated some dollars to some of these organizations now, Feed the Children and Medicine Sans Frontières. So as I was saying before, every year I have my integrative health master's students adopt an international health NGO. And the word applies, of course, to nonprofits who work internationally. And most often they try to work independently of any nation or public health system. So for all the hardships in the world of global health, there's numerous case studies of people and resources coming together with successful efforts to lift the burden of disease and improve lives and livelihood everywhere. So NGOs have been both lauded and criticized for their work in the world. And to medical anthropologists, we watch very closely to see if that NGO does a lot of bypassing of the public healthcare system in a country or region that is truly ailing. It's got an ailing infrastructure. It can barely get the community health workers the drugs and resources that they need. And sometimes we have to say that some NGOs come in with these megastars, corporate humanitarianism from a distant wealthy nation, and the efforts provide some limited heroics but fall short on sustainable actions. So if you want to work in global health, you want to know how to evaluate an NGO, and you should investigate the organization's mission and their effectiveness and their fiscal responsibility, their successes, their weakness, and their opportunities for volunteers too. So your initial queries, mind you, will only uncover the public face of that NGO, what is presented to you in a website or a brochure. But I always ask people to delve a little deeper and look at things like Charity Navigator. There's various rating systems that you can check out as well. I think in working, I love a lot of the local scaled NGOs, microcredit opportunities that really help change the social conditions that created the poverty or the sickness. Riders for Health is two Brits that got together and decided to fix up old dirt bikes and bring them to Africa because there was such a problem with people actually having the drugs delivered. I mean, when you're on a TB drug, you have to take it for 6 months, and somebody has to watch you take it, and sometimes just getting out into the field, into the jungle, and everywhere else is a problem. So these are some of my favorite local NGOs that work hand in hand with the people right there and building the capacity that they need. I love this book by Paul Hawken. Did any of you know it? Blessed Unrest. He tried to put it all into one book. All of the NGOs, he said, this is an extraordinary movement. It's the largest movement in the world. It's the movement of the average person saying, I want to help. And it challenges the power of corporate elite everywhere. And what he did was say, it was silly of me to put all these NGOs into one book, nonprofits into one book. And so now it's transferred onto a website that is continually building. It's almost like a wiki where people can not only talk about the nonprofit that they're engaged with and the good works that they're doing as well. So check out Blessed Unrest on the web. What kind of skills do you need to work with an NGO? Well, what kind of public outreach and education can you do? Can you provide funding or resource support? So there's some NGOs that will actually say, go ahead and shadow that nurse or doctor in the field and just be their right hand. Run errands, do what you need, hold people down, get people up. It really does help to work with some local language as well. There's some very small-scale NGOs that would love it if you came with some language skills too. Wellness tourism. Just take another break here for a second. What is wellness tourism? How is it different from medical tourism? Last year I lectured at in Austria, the University of Graz. It seems to be the center of the universe for wellness tourism. It has PhD and master's programs teaching people how to position themselves as the one country that has the greatest wellness. So you can come to that country and you can take the waters. Their mineral springs are more buoyant, more edifying in general. You can partake in the yogurt in Kiev now, and it's supposed to be incredibly lifespan oriented. There's a global wellness summit in Aspen coming up in June, in which countries again are vying to say, we are the wellness lifestyle. And it's interesting to watch Australians talk about the wellness lifestyle because they'll show videos of twins in leather bras running on the beach versus Austria talk about the wellness lifestyle, which has elders with their walking sticks climbing mountains. So everybody has a different definition of what wellness is, but they are really promoting their country, their diet, their lifestyle, their hotels, and beckoning you for your wellness vacation. The Ayurveda spas of India are some of my favorites as well. Anyway, just a little aside on that. Healing pilgrimage, this is where I want to take you next, and I'll be closing with this too. A spiritual healing pilgrimage. I've got a 6-year project in the works right now of investigating spiritual healers in the world who are really acting as Mecca for people. And we're talking about Germans and Swiss getting on 747s on huge tour packages to go to one part of the world where there is a renowned healer. So I'm going to show you a slide story about some investigations I did on that just in Brazil. But these are the various areas where I'm hearing stories, and as a medical anthropologist, I'm going in, I'm asking people for documentation of their great story of healing. Are there MRIs? Are there CAT scans? Yes, you said your tumor resolved, but how can we look at that in terms of normal spontaneous remission rates, where tumors sometimes do just disappear? What is the actual prevalence of that in society? And how does this spiritual healer that you're talking about work their magic? So whether you think that this is truly spiritual healing pilgrimages or a facet of divine intervention, or that these are just sheep all flocking to somewhere out of desperate hope, I think that we can look at this with somewhat of an open mind. especially here at the Institute for Health and Healing, that works with subtle energy medicine all the time, whether it's massage or Reiki or guided imagery, but there's lots of ways we haven't really tracked this elusive animal, the intrinsic healing power within. So this room that you're looking at right now, big empty room, do anybody recognize it? Anybody made this pilgrimage? This is the Casa in Abadiânia, Brazil. It's the room where people assemble to see John of God. And we're talking about 4,000 to 6,000 people a day that fly anywhere in the world, land in Brasilia, take about a 2-hour bus ride to show up in this room. This is John of God. He's the medium Joao, is what he prefers to call himself. He is a Portuguese man. He says he's uneducated. He says he's illiterate. And when he was 17 years old in his little village, actually it happened twice, when he was 7 or 8 years old and again at 17, he stood up in a little community center and said that he was overtaken by another spirit, and that spirit directed him to do healing work on people there, and then he fainted. And when he came around, people told him that certain healing miracles happened while he was out. And from that day forward, he has become this kind of dedicated healer who's right there in Abadiânia, which is 2 hours from the capital of Brasilia. It's butts up against some parts of the Amazon. And he's doing what a lot of faith healers do. He uses 3 different techniques. He cuts the skin. He scrapes the eyeball. When you get up very close to him, you find that he's actually kind of, I think, touching the sclera of the eye, which doesn't have the same dangers as really scraping the center of the eye. Is that right, Dr. Bills? I think what he's doing is something that has been called sleight of hand by skeptics and called a miracle by believers. In this picture, he's not himself. He says he's incorporating one of 33 different spiritual entities. And those entities are anywhere from people in Argentina, doctors who have died in 1890 who want to come back and work through him, to Loyola of Ignatius, a 15th century, 15th century monk. So here are some big fans of the medium who are Oprah and Wayne Dyer, and have popularized this, and as a result, a plane ticket to go see him has gone from about $800 to $1,200 to almost $2,000 to $3,000. And just in one announcement in Oprah's magazine, this happened practically overnight. Tours, mostly, when I went there, it was mostly Europeans. I was pretty amazed. There were a lot of Americans there, but there was a lot of Germans and Swiss, Norwegian, and England, because he's actually made trips there as well. He takes no money, but of course his casa is open to donations. This is what somebody does when they arrive there before they get to see John of God. They're told to put their head in this triangle and to offer up some prayers. Again, no donations are accepted. I found that everybody that I interviewed there as a medical anthropologist was told to buy the water there, which looks just like this, but it's been blessed by John of God in his entity state. And you have to drink the water there, and you eat the soup, and you stay in the local casas, which are the local hotels, some of them family-owned. And just about everybody is also told to go by the herbs. So you can be in line to see John of God, and he speaks Portuguese only. There's an interpreter there, and just about everybody is told, go over to the pharmacia and buy passiflora, which is passion flower. Passion flower is a kind of a mild sedative. They have you take 3 capsules a day. It winds up being about 300 milligrams of passion flower. It'd be like taking valerian. Is anybody taking that? Or having lots of great organic chamomile tea with lavender. So you do have this kind of relaxed sense there. Everybody's on the passion flower. Everybody's sleeping well. You're all eating the same foods. And of course, there's no TV or internet. So you're in a kind of a stress-free environment too. This is a what that room looks like when it's open for business, in a sense. People can sit and wait 4 to 6 hours at a time. They get rather stuporous waiting. Because during the waiting, a series of people who are very close to him, his inner circle, about 6 to 7 individuals, will give constant talking in prayers in Portuguese and little sermons and little lectures. So even though they call it a non-denominational, that it is a Spiritist community, Spiritism believing in reincarnation and possession of entities into the body, there's all these kind of religious iconography all around there. Mary, Jesus, Joseph, quite a few others, saints. The waiting goes on for a long time. I found that there was kind of I called them the henchmen. They were like the mafia. They were these big guys that surrounded John of God. There was about 7 or 8 of them, and they are in charge. You never get to really talk to the big guy. You have to go through this gauntlet of other individuals. There's one right now next to the silencio sign talking. They guide you, direct you, move you to the pharmacy for your purchases. This is the room. This is an idea of some of the lineup that goes on where people stand 4 to 6 hours waiting. And when you get in front of John of God, you're there for about 30 seconds. No, 2 seconds for most. People are very often overcome with emotion afterwards. This woman here told me that even though she went in front of him and she asked for help, that she found out at the same time that her father, who was dying back in Sao Paulo, suddenly had an incredible recovery. And so she's attributing that to her time here at the Casa. So there's lots of stories being told all the time, and it kind of builds up into this, what I call a frenzy of belief. More people waiting, more people waiting. Local Brazilians sometimes drive 5, 6, 7 hours. They sleep in vans there. This is a peek into another room. After you've sat and waited 4 to 6 hours in one room, you get escorted into another where people are said to be in current. This is John of God coming out at the end of a long day to sign a few autographs at the back door for those lucky enough to get to him. There are many individuals who have picked up and moved there, expats, who say that they are now guides, and you pay them a couple $1,000 as well as your travel there, and they kind of help organize your participation there. They help move you to the front of the line. They try to win favor for you as well. Another one of his close workers, I'd say the staff of paid workers is probably small, 8 to 12 individuals. Now this is the inside current room. Current room means that they are sitting holding energy for John of God to do his miracle works. Look at the blinds, pretty amazing. Here's another picture of the current room. These photos haven't been taken before. We had to get special permission to take these. I went with, my partner is also an anthropologist, so we're doing an entire investigation into these 6 supposed great healers of the world. So these people have been sitting here for longer than 4 hours. They sit for 6 to 8 hours all day. I think many of them are asleep or passed out. People are on so much passion flower, it's hard to say. But they're supposed to be holding the energy for you while John of God does his work. Who remembers Peter Pan? Do you remember Clap for Tink, kids? Clap for Tink, clap for Tink. Tinkerbell was dying. That's what they're doing. They're clapping for Tink. They're sending energy, holding energy to make sure. And there's one person who just walks around that room and says, you're not sending him enough energy. Things are not going well. It's pretty amazing. Here's the lineup to see him. Again, the energy holders on the side. More energy holders. Right. What do they look like to you? What are you seeing here? More people holding. Now we're finally up in front of him. He sits there, he doesn't really look you in the eye, he's looking all around, his eyes are fluttering. He has no awareness of who has overcome, who has supposedly taken over his body at that time. But you go up to him with your sentence, there's a Portuguese translator there, and you say anything from I came from America, and I have a tumor on my right ovary, and I'm worried about it. Is there any way you can heal it for me? And you will be told either go to the current room or you'll get surgery. At that point, you're escorted away. Here's a woman who's giving her plea. You can make one request, one short request. And some are being escorted away here. A few years ago, John of God had a stroke, and he decided he needed to do surgery on himself. So he waited till the spirit came in, took him over, and here he is cutting himself. He says he can't stand the sight of blood, and he couldn't have done this without being possessed. You want to know why? I mean, I can hear it in your heads. If you had a stroke, why do you need to be cut, right? Cutting is very symbolic, and we have to think of Brazil as an overlay culture. So you have indigenous spiritual beliefs with an overlay of colonialism and Catholicism. People say that Catholicism is the #1 religion there, but because you have so many overlay religion and spirituality forces afoot, including Afro-Caribbean, 3 different religions that came, and runaway slaves with their own religions, legacy of those as well, that it's a really rich, complex spiritual ethnography there. And cutting is kind of an alive and well symbolic act within many of those Afro-Caribbean and Catholic religions. These are people buying their herbs. I think the herbs run about $50, maybe $40. When you're seeing 6,000 people a day and everybody has to buy a bottle of herbs for $40, you do the math. John of God has 3 big houses and a ranch. So he may have started out as an illiterate, uneducated Brazilian man out in the remote areas, and now this is a massive money-making venture. This is a crystal bath table. You can lay down on this thing, and these little plastic crystals light up, and for another, I think, $20, $30, you're told to take several crystal baths a day. As a man who's lived there for about 7 years, many people just come and they love the energy so much they don't leave. This was one of my favorite rooms. These are jars of body parts. Jars in formaldehyde of probably little fatty adipose tissue that had been taken out from those cuts that you saw on the belly. But there's some really strange looking things in there. I don't know. I haven't seen anybody put a piece in a jar, but that's what you're told. There's all sorts of crystals you can buy there as well, massive crystals. And like Lourdes, there's a room of wheelchairs. The wheelchair is symbolic in countries of people in desperate spiritual pilgrimage. Get out of the chair, get out of the chair. We have our own TV ministers who do this, as if use of a chair is somehow a death sentence. I think that it's very symbolic. The crutches and everything else you see in this room, too, are definitely third world kinds of materials here. We haven't seen a lot of this stuff here in the U.S., I don't know, in this century, or the recent past. There's rooms of people who say their vision has suddenly improved. Glasses. I mean, it's part of the shedding as well. Anybody been to Lourdes in France? Very famous, right? Where van after van, huge busloads come up here all day long. This is the village that surrounds the John of God Casa. And there's much disaffection in villagers. They see vans come from the airport of wealthy individuals from around the world putting this money into the casa, very few of them using any of the services in the local village. Some of my work investigating true shamanic healers. And this is one in Ecuador. And one, he actually is very proud of his sign there, Association of Curanderos and Healers in Ecuador. He was in the foothills of the Andes outside of Quito. And he's showing me his little business card he just made up. He has an 88% cure rate in his village. 2 medical anthropologists were there before I was investigating that cure rate. Even if he was working with placebo, placebo can be anywhere from 32 to 48%. An 88% cure rate is exceptionally high. There's more investigation going on, what that means. In any way, he has the belief and the love of his community. He is their healer. And it just lets us know that this extraordinary power of belief is something we should track. It's elusive. We don't always understand what is the inward mechanism of healing. We call it placebo in a dismissive way, but it is maybe some of the most powerful medicine out there. You do a nice job of that in your book. This is Don Luis's altar. I love this altar. It's got his Lark cigarette pack on there. It's got tequila on it. It's got all of the magic of his trade. Whatever his tools are, these are potent images for him, and he has all of his deities there as well. He even gets deities and he puts them on there of people who come and visit him. That's why Buddha is sitting there. He had Bugs Bunny in there too. This is a Sami healer in Norway, up near the Arctic Circle. The Sami are the indigenous people of Scandinavia. And she's in her traditional dress. They work with some botanicals that are fascinating, that are hallucinatory. One of them makes it look like reindeers are flying. And between that and her little red outfit, you get the idea of a Santa Claus mythology. Other healers around the world we've worked at. This is a faith healer in the Philippines as well. We did our best to take a photo here that is really solid, and I'd say the energy was flowing. Well, I think that some of the things that we look at in the world in terms of overcrowdedness and lack of good nutrition and filthy water supplies and everything else, and a lack of access to decent health care, kind of foment this entire belief in spiritual healing. So while there is some really valid, extraordinary work being done by energetic healers in the world, like ones at the Qigong Institute in Shanghai that I visited, there's also a lot of sham operations as well. And it's a true buyer beware. And where their situation is more desperate, there's more vulnerability to sham operations. However, there's an effect going on in Brazil, and I'm going to close with this. There are over 200 Spiritist psychiatric hospitals in Brazil right now. And a Spiritist psychiatric hospital that I investigated has a staff of 200, 12 full-time MD psychiatrists, psychologists, 200 patients, 50 of them working in the, inpatients in a chemical dependency. Giselle Ramos is an MD who would like to have collaboration with American universities and hospitals to come investigate what he's doing there with mediumship. He believes that mediums can actually cure schizophrenia. So I went there with a translator to this, and I was able to witness a room in which everyday walk of life people, some of them were teachers, realtors, attorneys, human resource workers, this again is in Brazil, dedicate about 3 to 4 hours a week coming to a psychiatric inpatient hospital and doing an energetic laying on of hands, and also taking on an entity that talks through them about the person with schizophrenia. These are hospitals. This is wild. This needs investigating. They say that schizophrenia is nothing more than a dispossessed spirit entering someone and talking through them. And that's why it sounds like word salad and dissociative thought and everything else that we classify when looking at schizophrenia diagnosis. So I got to witness several of these dispossessions where they actually talk to the spirit they say is possessing someone and ask them to leave. One of them was a cardinal who said, "I'm not leaving. This guy's going to burn in hell. I need to take up residence in here." So you get these extraordinary conversations that could only happen in a country with multi-layered spiritual kinds of complexity to it. Allan Kardec was the founder of Spiritism. He wrote a book in Paris. It didn't take off well in there, but it took off very well in Brazil, where Chico Xavier was one of their national heroes of Spiritists. So at this hospital again, and it's a bona fide psychiatric hospital, and there's about 200 of them as well, all throughout Brazil. So I'm going to continue this investigation of why in particular schizophrenia. They're saying they're having a cure rate. We never quite use that word cure about schizophrenia here in the US. We talk about managing it through group therapy, talk therapy, and all sorts of psychiatric drugs. So just closing right now about global health, you can look at it as a consumer of medical services in the world. You can look at it as a supporter of some of the extraordinary international NGO work, the work that Dr. Shri is doing. You can support it with your volunteer hours, with your pocketbook, with your attention, with your advocacy. Or again, you can check out a spiritual healing pilgrimage for yourself and investigate that. I just want to close with thank you for letting me share some of my own investigations with this. It's really a pleasure. I appreciate you all. Thank you.